Is now starting. All attendees are in listen-only mode.
Hello, everyone. Good morning or afternoon. I'm Richard Davis. I'm the Vice President of Business Development and Customer Success here at NexTrust BillFlash. I'm joined by my colleague, Grace Totten, who is over our Account Management Department. Grace, do you want to say hello?
Hey, everyone.
All right. Thank you. Grace is going to be providing our training today on BillFlash's payment plan options. But before we do that, we do want to state our most sincere concern for everyone's well-being. We know these are challenging and uncertain times, so thank you for spending time with us here because we think that we have what we have to share can help your practices. But most of all, we do hope that everyone is staying safe and healthy. Real quick, by way of introduction, my background prior to joining BillFlash was spending 20 plus years in the payment processing industry, specifically on the integration of payment processing with healthcare software applications. So what we're going to be sharing with you here over the next few slides is a combination of that experience and as well as stats and trends that we've been able to obtain. So we're going to go ahead and get started. Here's what we're going to review today. Before Grace takes over and provides you the training. We just want to cover a few topics on why payment plans are important and what effect COVID-19 is having on patient payments. So we'll go over that along with how payment plans can improve the patient payment experience overall, how to minimize accounts that are sent to collections, and then how to manage patient collections during economic hardships. This will only just take a few minutes to cover these few things, and then we'll get right into the training. But to start off, I want to do a poll with you guys and interact with you a little bit. So I'm going to launch one here to understand a little bit about what you guys are experiencing with respect to patient payments. So if you can look at your screen and answer the question of what % of your practice total billing revenue comes from the patient responsibility portion of payments, not what insurance companies reimburse to you, but what you rely on patients to pay you. We've got about 21% that have voted here. So I'll close this here in about 10 seconds and share with you the results. What % of your total billing revenue comes from patient payments? I'm actually quite surprised by what I'm seeing here. So I still see some numbers coming in, so we'll give it a couple more seconds here. I've got 71% in. And I'm going to go ahead and close this and share with you the results. So a majority of you are saying that 21 to 40% rely on patient payments for your billing revenue. And that's exactly right in line with some of the data that we are seeing come in, 21 to 40%. Back in 2013, here's just a quick interesting fact for you. Aetna CEO at that time, Mark Bertolini, was addressing a group of attendees at the HIMSS conference. And he predicted that by 2020, more than 50% of the healthcare dollar would be patient responsibility. And we're seeing that 50% of you here on this webinar are saying that it's up to 40% of your billing revenue. So I think what we're going to share with you here today is going to validate that. So let's just get into that. I'm going to share with you my screen now. We'll get back into the presentation. Before COVID-19, patients were already struggling to pay premiums. And now because of COVID-19, we're seeing an increase in patients who are not able to do so. So instead, they've turned to payment plans or a grace period. This number of patients who are unable to meet premiums and are relying on payment plans represents 3% of United Healthcare's users. And that's as of March 2020. That is up from 0.4% in a typical month. That's outstanding numbers. That's an outstanding increase from 0.4 to 3% that rely on now payment plans. I can personalize this a little bit. I had a procedure done at the beginning of March, right before COVID-19 broke out in the United States. It was an emergency surgery. I'm now receiving the bills, and I'm being presented an entire healthcare bill. And I'm looking for options to break that up into payment plans. So with outstanding bills, patients are unsure if payment requirements have been relaxed. We know that many other industries have relaxed some of their payment terms, like the rent industry, utility, etc. But that's still unclear in the healthcare industry. And so if your practice has relaxed its payment terms for outstanding bills, it would be important to communicate that to the patients so that they're aware. Then provide for them in that same communication what their payment options are. And we'll discuss here shortly what we recommend to ensure highest success of getting paid. And then following that, Grace will show you how to do it here in BillFlash. Obviously, in-office payments have declined, so you'll need to turn more to online payment options. What CV-19 has essentially done and taught us is it's escalated the communication and payment methods that patients actually prefer, which is electronic and online. But we still don't see providers adopting these methods, and we'll discuss what those are. So it is really critical right now for your practice to succeed in patient payments continually through these uncertain times, to take advantage of some of these methods that we can provide you as your partner in this. Pre-visit charges we offer through a product we call LinkPay. It allows you to email a charge to patients and allows them to pay online prior to a visit. This is especially important if you're providing any telehealth visits right now. Send them a LinkPay option, make a portion of their payment, whether it's just the copay or a portion of the patient responsibility prior to that visit. That's really important. Capture some upfront pre-care revenue. Then you can turn that payment into more successful ongoing and recurring payments. So our electronic statement bills really meet the needs of what's happening right now with physical distancing. You don't have to physically handle bills and put them in the mail and let postmen deliver them and handle them. You can send an electronic statement the same day as the visit occurred with online payment options. These payment options can turn into payment plans. Now, this is really important to start creating payment plans, and that's the essence of today's webinar. Payment plans are so critical right now because unless you're able to break up the total bill into smaller segments and over incremental periods of time, patients will not pay their medical bills at all. But if you can create payment plan options, smaller segments of the total bill amount, you're more apt to receiving the entire bill. Let's get more into that. Automating patient payment plans. 90% of providers today leverage paper and manual processes for collections and are not taking advantage of patient preferred methods of electronic and automated payment, online payment options. Higher billing volumes because of higher premiums, higher deductible plans. Higher billing volumes are just not going to get paid unless you can work with the patient to break out those volumes into smaller payment amounts, like I was just saying. Additionally, automating payments for your practice is especially important during these uncertain times like what we're in. So you have to automate payments. How this improves your overall practice revenue? Well, 44% of patients, let me say, have used a payment plan in the past, and 90% are interested in trying them in the future. So right now you have 22% of patients that are more likely to pay in full the entire bill. I'm one of them, to pay in full if they're broken out into smaller payment plans. 91% plan to pay off their payment plan in full, either early or by the scheduled time. So you can see how this can affect your practice even right now by breaking that bill into smaller segments over time. And finally, managing late or unpaid bills during economic uncertainty may require a different approach than what you're used to. Before you send patients to collections, make sure you take these steps first. Many people are hoping for leeway on certain bills due to the economic impact of COVID-19. But you can gently remind your patients that for essential healthcare services to continue, practices need to keep revenue flowing, and that means billing will continue as well. Use whatever resources you have to send out reminders, email, phone, text, mail, to contact patients about balances they owe. Remember to be courteous in your reminders, but firm. Most patients want to pay their medical bills, they really do, but often they just need a simple reminder and an easy way to make that payment. Okay, last thing before we turn over to Grace is simply saying that if you can be empathetic towards the patient and saying something simply like, we understand you may be experiencing financial difficulties at this time, it's more likely to get a response than a curt final warning threat. Like any other business or practice that relies on revenue to stay open, in order to continue to provide these valuable healthcare services, patients need to pay their bills in full and on time. So you can convey some kind of sense of urgency by saying something like that. And then being upfront with patients about payment expectations and being willing to work with patients who have fallen on hard times will help all of us through this global health crisis. So with those few things in mind, and if anybody wants a copy of this webinar to be reminded of these things, just let us know. We'll be happy to send you a recording of this. But for now, let's turn it over to Grace. I'm going to make you the presenter here, Grace. And we'll let you take them through BillFlash. So,
All right.
should be yours.
Perfect. All right, everyone. So I am in one of our test accounts right now. So if you have our payment processing service already, a merchant account with BillFlash, then the plan pay is what we call it, the payment plan. Should be something you already have activated on your account. If you go into your account and you don't see it, you can just shoot our support team an email or give us a call directly. We can get it activated right away. If you don't have our payment processing service already, then we can get you signed up. Let me show you how to get the service enrolled or to get a payment plan started. What you'll do is you'll come into this tab right here in your BillFlash account that says My Payers. So I already have that open here. So what we're going to look at is we're trying to find the patient we'd like to add what we call a plan pay to, which is all the way over here. It's called plan pay. This is just my test account, so this is all test data. When you come in here, we have a search by function right there, and that allows you to search for the patient that you'd like to add the payment plan to. Oftentimes, you'll have pages and pages of patients in here, so you don't want to go through every page to search for the patient. So that search by bar lets you search by the account number of the patient, their name, their email address even. Method, I wouldn't really worry about that, but those are the three main searching options in here. So you search for the patient and you pull them up. For some reason, if you can't find the patient, that just means that you've never sent a statement to them or collected a payment from them through BillFlash. So you can always use this button up here that says Add Single Payer. And this lets you manually add a patient in your system that you want to do a payment plan for. So you'll need their account number. It's important to make it consistent to what it is in your practice management software. So whatever you're using, pull their account number in your practice management software and put their account number in here. The importance that it matches up is that later on you might want to take a payment for them or send a statement to them, and it's nice to have that continuity. It's the same account that has all the same history on there. So you put their name in as well. The system makes you select the method. So this is just if you're sending them a statement, how they'd like to receive the statement. And then email address is also a mandatory field when we're adding a payer in our system. It's also a mandatory field when you're, excuse me, when you're adding a plan pay for a patient. So you put that in there and hit Add Payer, and it'll add for you. So let's go ahead and look at someone that's already in the system. So I'm just going to look at this Andrew Austin patient. So maybe Andrew wants to add a payment plan. So we come in here and we click Add under Plan Pay. Pulls us up into this screen. So this is the section we're going to use to add a payment plan for Austin, Andrew Austin. So it gives you a space right here for agreement notes. So this is internal use only. Some offices like to use it. They like to put in like, Andrew decided to have a payment plan. He has a large balance. We're working with him or whatever it may be. Every office is different. It is optional. Some find it helpful. Some don't use it at all. So do whatever you'd like there. Then monthly payment amount. So this is how much we're going to automatically take from the patient's checking account or credit card per month. So sometimes it's an even number. Sometimes it's, not. So I'll just put $50 there. So $50 is going to be taken from Andrew's checking account or credit card every month. That's the amount. Then we enter how many times we're going to draw that $50. This is the number of payments, or how many months you want it to run for. So maybe it's a full year, we put 12 in there. And then you select the monthly date beginning. So if you click in here, it actually pulls up a calendar and it allows you to select the day that way. Sometimes you have to go like, to the next month if they want it to start a specific day, maybe it's the 5th. Whatever day they'd like, you can select it here. Most patients have a specific day in mind when you're setting this up. So I always think to ask them first. Then you enter their email if it wasn't already in there. So I'm just going to put a test email in here for now. And then you choose payment method, card or checking account. If you select card, the system's going to ask you to swipe the card. If you have a credit card swiper with us, you would just go ahead and swipe it. During these times, I feel like most people aren't seeing patients face to face. So click here to key in card information is probably what you're going to be using there. Then you key in the card information and hit submit. The checking account, you put the name on the checking account. You'll need the routing number and checking account number in there to complete it. So let's go ahead and just put in some safe data so we can see what it looks like. So we put their zip code in there. So it's similar to when you're processing a transaction. We're just entering this in so that we have the information for when we need to draw that $50. Let me go ahead and hit submit, and the payment plan is being added. That is, all of our payment plans have to be authorized. So we can go back in here and we can look at that. It right now says pending. This payment plan has not been authorized yet, so we want to go ahead and authorize it. The importance of authorizing the payment plan is that if later on Andrew's like, wait a second, I never agreed to this, I don't know what this is for, the authorization kind of covers your you in that situation so that you can say, hey, this actually was authorized by you. So what we do is we click on this authorize. There's different ways to authorize a payment plan. The first one we want to look at is the email. So we can go ahead and send Andrew an email. We can select this and the email authorization to the payer. This is what it looks like when he gets the email. It'll tell him the office it's from, and it'll say, hello, Andrew, we're authorizing the payment plan. He'll just have to click, I agree, activate plan pay. And it goes ahead and activates that plan pay. If email's not a good option, we can always select paper. The paper one does print out an authorization for the patient to sign. Right now, that might not be the best option for a lot of offices, but a lot of people have built into their check-in forms an authorization for a payment plan. If you've already received authorization from your patient regarding the payment plan, you can always just check mark, I've received authorization, and activate plan pay. So this is something that you can do even if you haven't done the email. Maybe you're doing it your own way. A lot of the offices that I work with have gotten verbal confirmation from their patient over the phone that says, this is the payment plan I want, I'm ready to go, let's set this up. So they've been comfortable saying, I've received authorization. You can even put a note that said like, Debbie spoke to Andrew to authorize. If you're comfortable doing that, I recommend go ahead and clicking that and hitting activate plan pay, just so it is ready to go right away. So once it's ready to go, it'll run automatically on the given time of the month. So if we click on here where it says active, it'll show you the details. So this is just bringing up all the details from the payment plan. According to the 12 payments of $50, this patient owes $600. So it'll show you all the completed dates in here, and anytime it might not, or anytime it goes down. So like a completed payment on 5/5 of $50, remaining balance would be $550. So this is kind of just a breakdown of what that looks like. That can actually also be found under Get Paid. You can do Manage Plan Pay, and that's what this screen is. This is where you manage your plan pays. So say one of your patients decides, my card's expiring, I need to do a different card, I need to change the day of the month that it's run. You can come in here, you can cancel the payment plan, you can click on this where it says card ending, and you can edit that. It allows you to do that. It allows you to change the day of the month. Maybe the 10th is no longer good for this patient, we can adjust that there. In this section, which is under the Get Paid Manage Plan Pay, we can also see if a payment plan fails. We can just click into it here where it says active, and it'll tell you the completed dates. So if one time it doesn't run, we'll put a failed in there. What we're doing when a payment plan fails is we're sending an email to the patient and we're saying, hey, your payment plan failed for Happy Valley Medical Clinic. Please contact the office to make for different payment arrangements. But we also send you guys an email too. So when you are setting up payment plans, you can discuss with us like the email you'd like to have that notification go to. Just call our support department or account management directly. But that email will go to you as well, and it's saying that this patient's payment plan failed. So if that happens and you come in here, it'll tell you that it failed. But after speaking with the patient, you can actually click on where it says failed, and it'll let you resubmit the payment. Some offices like to resubmit. We do also get, you also get the option to skip a payment, so there'll be a skip option too. Anything you'd like to do, sometimes it's not a good month, they just want to skip it, especially these days. If they want to resubmit it, they can, and that's just because maybe the first time they didn't have enough money. Now, a few days later, they have the money in their account. So anytime you need to do any specific things with your payment plans, that's found under the Get Paid Manage Plan Pays tab. All the plan pays show up on your payment report like any other payment. Any online, telephone, mail payment show up on your payment report in BillFlash. The plan pays will as well. It'll say plan pay, so you know it's a plan pay. And if you have an integrated practice management software with us, those plan pays drop into your practice management software, similar to any of the online payments. So it's very seamless as well. The thing about plan pays is we can only have one plan pay per patient. So something to keep in mind, if you're trying to add an additional one, it won't let you do that. If you do need to cancel and reset it up, you can just hit cancel and edit that. The only thing we can't change is the amount that we're taking out of their account every month. So the day of the month and the method can be changed, but if you needed to change the amount, you'd have to cancel and reset it up. If you want a specific, one-on-one training on plan pay, you can give our support team a call, or, if you know your account manager directly, give them a call as well, and we'll set that up for you. It's pretty easy and user-friendly, but again, if you guys have any questions, feel free to reach out to our team. I think that's it as far as the training, Richard.
Yeah, that was good. Do we have any questions that people have regarding this? I only see one question, and that was somebody asking for a copy of the webinar. Anybody have questions related to the data we shared today or the training? I don't think we do, Grace. So I think we're good there, guys. Thanks for joining us. That's really all we have for today. So like I said, if anybody has a need for this recording, I've got, we did have a question come in. How does this plan pay work on family accounts?
Yeah, that is a good question. If it's a family account with children, and there's like a parent as a guarantor, all of our billing is guarantor based. So the account number in your system should be the guarantor's account number. The way that works is that, again, we can only have one payment plan associated with that guarantor account number. If it's a situation where you'd like a payment plan for multiple different children and it needs to be set up as separate payment plans, I would recommend just adding the children's account numbers into the system and doing it that way. But if you have more of like a specific complicated situation, feel free to reach out and we can discuss that kind of one-on-one.
The other question that came in is, can we get the sample verbiage for the statements?
Sorry, can you repeat that?
Can we get the sample verbiage of the statements?
The sample verbiage for like the plan pay authorization, or?
Yeah, that's how
there would be no statement with the plan pay. So yeah, so with the plan pay, if you do need to send them statements, it doesn't affect you uploading a normal statement for them and going out. There isn't verbiage that's automatically put on their statement if they do have a plan pay. Some offices like to do additional messaging when someone does have plan pay, but that has to be added either on the software level or from BillFlash in the edit section. So just because they're enrolled in plan pay through us doesn't mean we put specific verbiage on their statement.
Okay. And then we just got another request for a copy of the webinar. So let's see. Oh, Marie says she understood that. So we have a question here. I don't have stored play or plan pay on my account, only auto pay. How can I get the other ones?
So it has to be added through our system. So if you don't have it, if you could send an email to support@billflash.com, reference your biller ID, and just let them know that you'd like to turn on the plan pay feature, and we can go ahead and get that added for you. It's really quick. It takes them about 2 minutes.
Okay. And let's see. So is it Miley Schick? She's just wondering. She's referring to the regular statement for the COVID crisis specifically. I'm not sure what that's referring to. Maybe Grace, what's the best way for people to contact us for some follow-up questions here?
Yeah, so I think just for ease of email, if you want to just send an email to support@billflash.com, just let them know you're on our webinar, and I'll just tell our support team to tag those over to me directly.
Great. Great. I think that wraps it up. That's all we have.
Perfect.
Great. Everybody, thanks again for your time. Again, please be safe and well. Stay in touch with us and let us know how we can help you during these challenging times. And look forward to serving you. So thanks again for joining. That's all we have for today.
Thank you.
Thank you.